Well, it's an honor and privilege today to be in the presence of Dr. Larry Cheskin. We are chatting with Cheskin today. Dr. Cheskin is the founder of the Weight Management Institute at Johns Hopkins University. For over 30 years, he's been studying obesity and treating patients. And he has over 200 publications you've been involved with, right, Larry, where you have actively done studies or done, what is it called when it's a study or a publication?
A clinical trial.
Clinical trials, yeah. For over 30 years, you've been actively involved in that with obesity,
Yes.
correct? So we feel very privileged to have an opportunity to chat with you. I wanted to find out a little bit about what your knowledge around, we call it fat burn. Ketosis is the clinical term for it, I believe. Can you share studies, how to get into that state, what you've seen as far as results from someone being in fat burn? What I understand is that's one of the most, well, you just educated me, it's one of the most inefficient ways perhaps to put your body into so it loses weight. How would you define or describe that state?
Okay, so ketosis is a condition that you go into when there's a limited amount of carbohydrate in your diet, and it basically forces your body to burn fat instead of burning carbohydrate. So the American diet, the world diet, is largely composed of carbohydrates. When you are limited in the amount of carbohydrates you eat, though, and your body switches to burning fat, then it produces these little ketone bodies, which are biochemical byproducts of burning the fat. And they can be fuel also, and they feed back to your brain in ways that we don't well understand, but they feed back to your brain that there's a food shortage, there's starvation possible, and it makes you less physically hungry in many cases. So many of the studies that have been done show that ketogenic diets, which are ones that will put you into this fat burning state because they're low in carbohydrate, are more effective, cause more weight loss, at least in the short term, than diets that are high carbohydrate and are just limited in the amount of fat in the diet. Protein is not directly related to a ketogenic diet. It's just that what do you substitute the carbohydrates that you're reducing in the diet with? You can substitute fats, you can substitute proteins, or a combination. So the classic Atkins diet was a very high-fat diet, and in many ways, I would say, is not a healthful way of eating, because you shouldn't eat all the bacon that you can. You're going to get a lot of saturated fat, which we know is not good for your heart, and other negative consequences. So a better way is to just have a little bit more protein and less fat, as well as less carbohydrate. And that's kind of a more healthy approach to getting into this ketogenic state. It's not to be confused with ketoacidosis, which is a condition you get into if you have diabetes and your blood sugar can go low, and you can develop a lot of ketone bodies, and it can be a serious problem. I've never seen anyone go into ketoacidosis from a mildly ketogenic diet like we've just described, though. So the benefits are that it seems to help people's hunger and appetite when they're in a mildly ketogenic state, and you cut the calories without suffering as much as if you just said, let me eat half of everything that I eat in the same proportions that I used to eat.
Beautiful. And just to clarify, what you said about diabetics is that it is a safe and effective space for a diabetic to be in ketosis. That is fine.
I do think that those of people listening who suffer from type 2 or type 1 diabetes in particular would be well advised to talk to their healthcare provider before engaging in any diet, and perhaps particularly one that changes the macronutrients and tries to eliminate or close to eliminate carbohydrates.
Yes. And I just want to, from my experience of being hypoglycemic, I want to say that my doctor has told me that if I wasn't eating small, frequent meals, and if I hadn't cut my carbohydrates, it was potential that I would be diabetic now because I would have worn out the insulin response. Is there any information that you have on that you could share?
That's a possibility. I don't think it's a clean-cut relationship that has been studied, but certainly that's a possibility.
But in other words, what you're saying is that diabetics and everyone before changing their diet should check with their doctor. However, being in the state of ketosis or fat burn is generally a safe state for the body to be in.
As long as it's a mild restriction in carbohydrate. You don't want to have zero carbohydrates.
Absolutely. Good. That's really great information. Thank you.
This is great. This is especially helpful for people that do want to lose weight or for people that really want to keep those blood sugars balanced. The ketogenic, I use that style of weight loss when I lost my 50 pounds. And you know what I even find sometimes, Larry, is sometimes it feels like on a day when I'm really active and my calories in are kind of close to my calories out, I feel like I'm in that keto state even when I'm not trying sometimes. Is that possible?
If your habit is that you naturally limit the amount of carbohydrates, then you wouldn't have to think about it. And in general, when people make things second nature, they're better at it and they do better. So I would encourage people to make it a lifestyle change that you don't have to force yourself to do each and every meal.
And
that's certainly what I've done.
I had one more question related to fat burn and ketosis regarding new studies out on Alzheimer's. Can you share anything around that?
I think that there's the possibility that it is helpful, but it is much too early to draw any firm conclusions from the studies that are out there thus far.
Beautiful. Thank you.
Well, thank you, Larry. This has been another great episode of Chatting with Cheskin. If you guys would like to hear more, we have several of these. We'll be putting out more as we go. If you want to